I'm going to share with you the useful supplements to strengthen our immunity in view of the coronavirus situation. So this is a hot topic now. Everyone is reading about the news, so you can use this as a topic opener, but definitely do not go straight into the products. Just show your care and show your caring and concern. And then usually people are stressed or they work from home, they're feeling under the weather. That's when, with this information and knowledge about the supplements, you are able to help and bless someone with our excellent products. All right. So without further ado, I go to my next slide. Okay, disclaimer, all these, right, same for all of our product related or nutrition prep presentation, we have a disclaimer. This is not intended to diagnose disease or any condition or recommend to treat any condition. For example, if you have a friend, he or she has been coughing for the past 2 to 3 weeks already, haven't seen a doctor. Okay, so in this, before you recommend supplement, the most important thing is to refer this person to go and seek appropriate medical treatment. All right. So the WHO has named this coronavirus, this new disease, the COVID-19, because it started in the late 2019. So this is a new name, COVID-19. So this is the territories where the COVID-19 has spread to, started from China and then to Singapore, Malaysia, and now last few days we have breakout in Italy and South Korea, right? So these red dots are those affected area. And the situation report as of 25th of February highlights that the new member states, right, have reported cases. The Algeria, Austria, Croatia, and Switzerland has reported cases of COVID-19 in the past 24 hours. Algeria is the first member state of the Afro region to report a case of COVID-19. So for the first time since the onset of symptoms of the first identified case of COVID-19 on the 8th of December 2019, there has been more new cases reported from countries outside of China than from China. So currently WHO, the risk assessment for the region, right, for China is very high. And then regional level, that means our nearby, the Southeast Asia, is still high. And the global level is high. So situation in numbers, globally right now we have 81,109 confirmed cases, and China itself has majority, 78,000 plus. Right now, unfortunately, they have 2,700 deaths. Outside of China, 2,009, close to 3,000 confirmed, and 37 countries are affected. 43 deaths, unfortunately. Okay, so these are the just a repeat numbers. Okay, so who are the high risk group? So most likely are the elderly, those with low immunity. For example, some people undergoing cancer treatment, or people who are ill, they are sick, or they have chronic long-term disease such as high blood pressure, diabetes, or people with autoimmune problem. People who are immobile, for example, they are bedridden because they are feeling well or sick, and pregnant, okay, as well as a group of our medical heroes in the white cape, long and close contact with patients, because they are taking care of patients every day, long contact hours, so they are at high risk as well. Then I want to cover a bit on the free radicals attacks on cells and effects of antioxidants. So on the normal times, right, when a cell, you can see this picture, when the cell is attacked by free radical, it will cause the cell to damage. Yeah, it will damage the membrane. So this is what the similar action, what the virus does to our body cells. So you can see when we have a stress and toxin chemical radiation, right? So that's when the antioxidant go and neutralize it, prevent the cell damage, neutralize the free radicals. Okay, next, what are the symptoms of the novel coronavirus, the COVID-19? So systemic means the overall body one. You will have fever, fatigue, feel very tired. Some people reported they don't even have cough or what, don't even have fever, no symptom, even though they have virus detected in their body. because their immune system is very good, right? Sometimes, unfortunately, the virus through the bloodstream go and travel to affect our kidney, resulting in a decreased function. Sometimes it go to the intestine, it may cause diarrhea. By respiratory, this is the most common one. So through our airborne disease spreading, right? Someone when sneezing, runny nose, sore throat, dry cough, and shortness of breath. If shortness of breath is because the virus go deep into the lungs, go down deep into the lungs already. That's why the lungs swell up. Swell up that time the lungs cannot have a proper function. That's why you feel like you are breathing underwater. You get drowned inside your own lung. Okay, that kind of feeling. Then it will also go into our bloodstream. Our circulatory system affect our immune cells, which are our white blood cells. So different organs may be affected to a different extent, and we need sufficient minerals and vitamins to protect and maintain the function. Currently, there are no available drugs or medicine to fight the virus. If someone is hospitalized, what the doctor do is just supportive therapy. For example, they inject some saline or nutrition through the body, and then they give them some medicine to reduce the fever and observe. If the lung is too inflamed, sometimes they actually give a little bit of a steroid to suppress the inflammation. But we all know the steroid is a two-way sword, right? So if you reduce the inflammation, actually you reduce the immune system. Then when the immune system is low, the virus actually spread more and erect more damage to the body. So this is always the concern. Therefore, the only way right now, if someone really unfortunately contract the virus, what they need to do is, other than praying, they need to have enough nutrition, keep their immune system strong, okay? Have to have active minerals and vitamins to protect and maintain the function. So how to prevent the spread of COVID-19? Wash our hands frequently, at least 20 seconds for each time, and avoid touching your face, eyes, nose, and mouth with unwashed hand. Keep a distance from people who are sick, or generally avoid crowded areas. Stay home if you are not feeling well. Cover your cough or sneeze with a tissue and then dispose the tissue in a trash. Clean and disinfect surface. So that's why everywhere we cannot find alcohol swabs, right? Alcohol liquid. But then you can use our SNAP range as well, because our SNAP has natural enzyme, is able to disintegrate the germs, okay, and able to clean the surfaces. Then you can also remember to maintain strong immunity, sufficient rest. How to improve our immunity? 8 hours of sleep, regular exercise 3 times a week, low carb diet, because high sugar actually processed food also will be converted into sugar, so it will actually reduce our immune system. Stay in nature. For example, you can go to not so crowded places like MacRitchie. You can breathe in more oxygen, more fresh air. Relaxing with loved ones, eliminating stress, 8 glasses of water a day, micronutrient supplement. Okay. So this is essentially the war between your immune system and the virus. So what are the functions of nutraceutical? It can support natural protective layer for our body, support and protect immune cells and their function, fight the virus, suppress the virus from spreading, reduce inflammation and support normal lung function. So what does one of the most important thing we do, right, the immune system do, is we have a natural filter, which is our mucus layer, and we can also use probiotic to help us. So when we breathe in air, right, the air have to go through our airway, and then on top of this airway, we will have this mucus layer to trap some germs or impurity or dust. So through this, right, this tiny hair on top of the cell, it will slowly push it out of our system. So it is able to trap it before it attacks our lungs cell. And then right, Chinese saying, there's a saying say 病从口入. Okay, 病从口入, like we eat something which is not hygienic, then the bacteria or virus can attack our digestive tract. So in our digestive tract, start from our mouth, right, our lips, we actually have saliva to help us not only digest the food, it has enzyme also as a defense mechanism. So here, when the food enter our stomach layer, we also have a mucus. Then our stomach also secrete acid to kill the germs. So all these are important balance that we need to maintain. So, but if our digestive tract is unhealthy, then our defense mechanism is lower. So probiotic will be able to help. So how do we enhance our physical barrier? So aloe contains 200 nutrients, including enzymes, vitamins, and essential minerals needed for good nutrition. Studies have shown that aloe, if you consume orally, promotes normal digestion and supports a healthy immune system. Next, if you can see on the bottom right here, probiotics in the respiratory viral infections. There are some studies that is able to establish some connection that probiotics actually, because it maintains balance and immunity, is able to help our body immune system fight viral infection. Next, we also need this nutrient, different ingredients, right? Nutraceuticals to help us protect our cells and maintain their function. So vitamins, we have C, D, beta-carotene is vitamin A, and vitamin E. Minerals wise, we have zinc, selenium, and then antioxidants, OPC, ORAC, resveratrol, thiamine, curcumin, coenzyme Q10. Then we also have the mixture. This is the formula, Wellmune, and immunity you can get from Global. It's a mixture of all the above ingredients. Next, amino acids are also important. This glutamine is found in our fiber and our TLS shake as well. Then glutamine, let's say if you have a digestive tract inflammation, it helps your digestive tract to recover. Then whey protein you can get from our TLS shake. Okay, first we go into vitamin C. Vitamin C boosts the immunity by helping our white blood cells function more effectively. Then we also have other protective cell called the NK, T, and B. It's okay, you just remember all these belong to the same family, which is the immune system. You don't have to go and tell your customer, oh, you know the immunity T cell, immunity B cell. It's okay. You will make them confused. You just tell them generally immune system. It makes your immune system stronger. And it also helps your cellular membrane health. Okay, if your membrane is intact, there's a lesser chance for the viral to attack the cell. Protect your tissues and reduce lungs pressure. So one of the reference that I got from, this is a researcher from the US. She is one of our nutraceutics, our isotonics consultant. She said that one day you can drink 4 caps each time you have to separate. So vitamin C, you can take 1 cap every 4 to 6 hours. You have to spread it out, because if you take 4 cap one shot, the vitamin C may lead to a bit of mild diarrhea. So you just remember to spread it out. Next is vitamin D. Vitamin D can help to naturally adjust our immunity. So vitamin D, we all know we have to go under the sun, but in Singapore it's very hot, and if we go under the sun, we may get more damage from the UV than more benefits from the vitamin D. So a very easy way to get vitamin D is through our supplement. Vitamin D is found in our Calcium Plus. It's also found in multivitamin. So there are 10 best vitamin D rich fruit you can incorporate in your diet as well, such as the fortified cereal, orange juice, egg yolk, mushroom, fatty fish, cod liver oil, and then the fish egg roll, and cheese. But cheese, if you seldom have a chance to take all this food in your diet, then might remember to take your supplement. Next is the beta carotene. Okay, it is a weak antioxidant, help us to fight the lipid oxidation in cell membrane, enhance immune system, protect skin from the UV damage, protect eyes on damage and other visual impairment. So vitamin E, the next vitamin is vitamin E, is also an immune booster. Next is selenium. Selenium is a micro mineral that our body need to get from diet. So it reduces the oxidation pressure and reduce inflammation. Selenium is very crucial for our overall health. Next is zinc. Zinc is also a micro mineral, and then it strengthens immunity, aids immunity. So it, if your body is lack of zinc, right, it will cause abnormal development of immune organs. So the thymic cells do not function normally. As a result, when the immune cell do not function normally, is susceptible to infection by virus. Yeah, so important to have zinc. The food rich in zinc are all these. Shall not go through. Yeah. Next, we cover antioxidants. So antioxidants in general, they are immunity booster for overall health. So this one, you can see this is a very nice photo. It shows how all these antioxidants are able to help different parts of our airway, our lungs. So we will cover briefly OPC, ORAC, resveratrol, curcumin, thiamine, coenzyme Q10. Okay, coenzyme Q10 can provide our cells energy, because when the cells want to fight infection, we need energy in the form of ATP. Coenzyme Q10 is very important for our cells to generate the ATP. Then our vitamins and minerals. So, okay, this, if you are Chinese, you look at the Chinese word, so I will cover the English word, okay? So antioxidants fight free radical, reduce inflammation, improve circulation in general. These are their mechanism of action. So OPC is shown to be able to reduce CRP. CRP is a form of indicator for inflammation. Platelet aggregation means the blood clot, and improve blood oxygen saturation. So ORAC consists of various berries, and one of them is the elderberry. It has shown to have antiviral effect. Next is resveratrol. It's shown to suppress viral multiplication, stimulate infected cells death. So the scientific name for it is called apoptosis. So the cells, our body is very smart. We are designed, God designed us in a very smart way. If our cells know that it's something wrong already, time has come, cannot make it ready, it will commit suicide. So this is, our cell is very smart. It's been programmed that way. It should know when to commit suicide. So this is, it helps us to stimulate the cell apoptosis. Same for curcumin and thiamine. Thiamine suppress viral multiplication, support immunity and cardiovascular health. Okay, next is astaxanthin. Astaxanthin can prevent the lung fibrosis, which means a lung infection, and also support lungs function recovery. So there are some studies published in this Elsevier, and one day you can take up to 2 capsules. Or this is the new isotonic astaxanthin you can buy from Global. You can drink 2 packets, or you can drink 1 packet and 1 capsule, up to you. Okay. Next is the bromelain. Bromelain is usually from the stem of the pineapple. So you cannot say, oh, it's from pineapple, I just go and eat the pineapple fruit lah. Yes, you can eat the pineapple fruit, but the bromelain inside is very low. You cannot get enough of the bromelain from diet, okay? And you will actually end up having too much sugar from the pineapple, okay? So what it does is it reduces inflammation, and it is widely used as medicine. So sometimes if a patient has mild sore throat or what, doctor actually prescribe bromelain tablet, okay? And the function is also able to prevent lung fibrosis. Next is resveratrol. It's available at global.shop.com. It is one of the super antioxidant. It is able to reduce viral infection symptoms and improve the microcirculation, suppress the viral multiplication, again stimulate the apoptosis, reduce inflammation and prevent lung